We are here at Blue Cross Blue Shield of Alabama, always bringing you information that's going to help you before something happens to you. And with us, of course, is Susan Green, who's the health case manager here at Blue Cross. Susan, thank you so much for being with us.
Thank you.
We're going to talk about something that's really, really important, and that's skin cancer. And a lot of people, when we're young, we do a lot of things that we shouldn't have done. But in most cases, what is the common skin cancer?
The most common skin cancers are basal cell and squamous cell carcinoma. The one we worry about is melanoma.
Right.
Those account for about 1% of all skin cancers.
And so basal cell is what then?
Basal cell is more of a surface cancer. It's least likely to spread deep or to your organs or lymph nodes.
So do you have those removed too?
Yes, most all skin cancers are going to be surgically removed.
Okay.
The more serious form, such as melanoma, sometimes requires additional follow-up treatment.
Okay, so what's the procedure actually to do that? I mean, do they dig it out, cut it out, they put you to sleep? What do they numb it? How does that work?
It depends on the location, the size, the staging of the skin cancer. Most of the time, it's just a simple excision in your dermatologist office.
Yeah.
But if you have a melanoma, sometimes they have to do a wide excision, take more tissue out. Those are deeper, and they usually do put you to sleep for those.
Okay, so interesting thing about both of those. When does a basal cell become a melanoma? I mean, does it start always out as a basal, or can it just start out as a melanoma?
If it's melanoma, it usually starts out as a melanoma.
Oh, okay.
Yeah.
Okay. Okay. So, is there a symptom? I mean, it's not that you get a headache. Do you get what happens?
Well, so you would normally notice a lesion on your skin that, like a mole or a wart, that has changed or become larger. It looks different from other moles on your skin.
Yeah.
So you would go to have that checked out. The
Yeah.
doctor would evaluate it, do a biopsy, and determine what type of skin cancer it was, and if it was skin cancer. And then he would determine what type of treatment you need.
Okay, so, all right, so that's between you and your doctor, right?
Right.
Do people refuse to get those things taken out for some reason, on their face or something like that? I mean, what's the consequences of things like that?
Well, it can spread and cause a lot of damage. And in the case of melanoma, if that's not treated, it can actually be fatal because it can spread to your other organs.
I think that's something that's really important, that it could be fatal.
That's right.
And a lot of people, they see these things on their skin, like brown spots, for instance. As we get older, we get these brown spots. Now, are brown spots basal or melanoma? No, or yes?
They can be.
Okay.
The main thing to look for are spots that have the characteristics of the ABCDE algorithm. Those are more likely to be a melanoma. A stands for asymmetry. It means that one half of the spot looks different from the other.
Yeah.
B, the border would be irregularly shaped or poorly defined. It may be scalloped on the edges. C is color. If you see one that if within the spot, if it has different varying colors, like blue, purple, red, and black, that could be a melanoma.
Okay.
D is for diameter, those that are the size of a pencil eraser or larger.
Right.
And E is for evolving. If it undergoes a change, if it changes color or is becoming larger, you would be more concerned.
So as we get older and we get these spots, I just went to my dermatologist recently, and he checked over my body and looked at it through a little glass thing and looked at different spots, and he said, and I was clear I didn't have anything going wrong, which was a great thrill. Because when I was a kid, we used to go to the beach, put baby oil on, and burn like a nice rare steak.
Yeah.
Which a lot of us did.
Yep.
So what about prevention now? What do we need to do to say, okay, we see all these things, SP40, SP3000, SF60,000, I don't know.
Okay. Well, the CDC recommends that you use a sunscreen that's water resistant and has
water resistant.
Water resistant and has an SPF of 15 or greater.
15 is not very much.
Well, 15 is what they say, 15 or greater on the SPF. You need to apply it 30 minutes before you go outside. Use at least an ounce, rub it in really well.
Yeah.
And then once you are out in the sun, you need to try to stay in the shade and reapply that sunscreen every 2 hours or more frequently.
So if you're out in the sun trying to get a tan, you got to stay in the shade.
Well, you shouldn't really be trying to get a tan. Any tan is skin damage, so we really don't recommend you tan.
I've seen these people at the pool, you know, and they're brown, but they're tan all over. Does that mean that they're?
Well, they have skin damage. A tan is not healthy like we used to think it was.
Yeah.
A tan means you have skin damage.
Is that right?
Mm-hmm. So we recommend that you apply the sunscreen.
Right.
Reapply.
Don't get any sun.
We recommend you can be outside, but take precautions.
Yeah.
Try to sit in the shade.
Yeah.
Wear loose fitting, lightweight clothing.
Right.
A broad rimmed hat. Apply that sunscreen every 2 hours or more often if you're swimming.
Right.
Don't forget the tops of your ears, the tops of your feet,
Right.
things like that.
What about age? As we get older, are we more susceptible or less susceptible?
Yes. As we get older and our immune system becomes weaker, we start to see skin cancers. And these are usually the result of skin damage or sunburn that we've had as children or growing up.
Yeah.
So normal moles that we had before can undergo a change and become skin cancer.
Well, Susan, thank you so much for being with us. Great information. If you see something on your body that looks different, talk to your dermatologist. If you don't have a dermatologist, go to the website on Blue Cross Blue Shield, and there's plenty on there you can talk to in your area.